Hello and welcome to Juicy Scoop. I am talking to a fabulous plastic surgeon, star of the remake, I guess you would say, of Dr. 90210 on E. I'm talking to Dr. Kat. I love that the show has come back and they did it with featuring you plus three other female plastic surgeons in the 90210 Beverly Hills, LA area.
Right.
And I think that was a great idea. To
it's
focus on the female plastic surgeons.
No, of course, because believe it or not, less than 15% of board certified plastic surgeons are women. When I was doing my training, it was like less than 10%. I mean, can you even think of like another profession where there's so few women? And so I think like for us, when we, especially during my training, it was just so male dominated. I didn't really have any, female mentors or role models. It was just really kind of lonely. So I think it's awesome that the show features women, especially since like over 96% of plastic surgery patients are women.
Yeah.
Well,
of course. Yeah. It kind of makes more sense, actually, that there'd be there should be more.
Right.
But that they know exactly what's going on. And so how did the show approach you then to be on?
So it's actually a long story. The show is so near and dear to my heart because actually it started 5 years ago. So 5 years ago, myself and another producer actually from Entertainment One, we brought a different idea to E. It was like I think it was called like a partner plastic surgery show. And back then it was like everyone wanted to have some kind of female plastic surgery show, just like couldn't get it to stick.
Right.
So I think they didn't like that idea, but they were like, wow, we want to meet you. They came to my office, and from some of like the brainstorming after that meeting, we decided to put together an ensemble. So this show's actually gone through a lot because we shot the original pilot over 3 years ago.
Oh, wow.
It was like in 2015 or 2016, and we put together an ensemble. Dr. Q is actually one of my original cast members. And then in the middle, and we had three. So in the middle of spring sweeps, I think we lost one of the, like something happened, and one of the third plastic surgeons, she ended up dropping out of the show. And then we were like stuck trying to find somebody. I mean, it's really hard to find like female plastic surgeons.
And in doing it, like, is there any competition between you guys as far as like, one having a similar specialty or anything like that?
Well, we're all super different from each other,
Okay.
and we don't interact really at all in the show. I mean, we all sort of know each other. Like Dr. Q, I've known for a really long time. Dr. Michelle Lee, she is pretty new. She's been in private practice for a year, and she also operates out of the same surgery center. And Dr. Kelly is in a practice that's just like down the street. So we all sort of know each other because there aren't really very many women.
Yeah.
But we don't really, like, it's fun for me as a viewer to watch this show because I actually don't even know what the other surgeries were that the other doctors did. So, like,
Yeah.
I watch it almost as a viewer.
Right.
So which is fun and exciting for me too. But the way that this show came about is that after that all fell through and I was like, oh my God, I'm so done with TV. The pilot was like so exhausting. 2 years ago, he called me back and they were thinking of maybe bringing a female element to Botched because Botched is one of their long-standing shows. And we were trying to figure out like how the female vibe and like the other two doctors, like how it would mesh. And then I think after all that discussion, they're like, why don't we just bring back this show? Remember like the pilot like that you did 3 years ago? And so then it got recast and everything like that. And then only recently it became Dr. 90210. They thought that it would be great to like bring back that connection.
Yeah.
And for me, I love the fact that the show's called Dr. 90210 because I remember, like, did you watch that show?
Oh,
way
I
back?
totally do.
I remember that show.
Wasn't
and I loved
Dr.
that show.
Nassif on that for a little bit, or no?
I
Because
don't think
I
so.
feel like I remember seeing Adrian Malufo. Maybe I didn't. Maybe
He
I
was
just
on The Housewives.
right. But I thought maybe I had seen him on that before. But now when I looked at the Wikipedia,
Like the list?
yeah. I was wrong. I must have had her mixed up with someone else.
Yeah.
But I do remember the show. I remember there was
I loved that show.
yes, and there was wasn't there like a
There was like a guy
like a
with cut-
Latina,
Yes,
like
he
a
was
Latino guy or
right.
Argentinian or something that was like had the accent and the cute family.
Yeah, and like the cut off scrubs.
Yes.
And I remember, it was funny because I remember watching that show and back in when that was filmed, it was totally different. You know what I mean? Like the plastic surgery was presented in a very different way than what we're presenting in our show. But I remember watching that show and thinking, wow, I want to be a Beverly Hills plastic surgeon. And I remember,
so that inspired
yes,
you.
and I remember telling myself, you know what? I'm like, I'm going to be the next Dr. 90210 one day. And I told my mom that.
Wow.
For real. And so when it all came about and it became the reboot of Dr. 90210, I was like, Mom.
That is working the secret.
For real. I was like, Mom, remember when I used to say, like, I'm going to be the next Dr. 90210?
And you have a very hot car that you drove up in.
Thank you.
And the license plate, is that your Instagram?
Yeah, it's one of my Instagrams.
Brilliant.
Yeah,
Is that you have a vanity license plate? That's IG surgeon. And then I saw also the license plate frame is Harvard University. Did you go there for both undergraduate and graduate?
I went there for college,
Okay.
where I was a molecular and cellular biology major, and then I came to UCLA for everything else. So I did medical school and 2 surgical residencies there. So it was like over 16 years.
And then when did you meet your husband along the way?
I met my husband in my very last year of plastic surgery residency, which was like, it was like worse than boot camp. I'm like just telling you, like literally you would go into the hospital on a Monday and you wouldn't like come out until a Thursday. Literally, you would just work all day. You'd be in surgery and then all night, just your pagers going on and on, like you're going back and forth into the ER. That's why when I became a mom, honestly, like waking up for my daughter in the middle of the night, it was like the easiest thing ever. I'm like, I've been trained for this, So yeah, I mean, surgery residency is, it's really, it's very challenging. It's very long. No, my husband, he's a business entrepreneur.
Oh, okay.
And we actually met because we were both part of the fitness industry. We're both fitness models in our past, and we got set up to do a shoot.
Wait, hold on. Okay, so you're also a fitness model who went to Harvard and UCLA Medical School. So you're like in between all of this, you're working out and putting on clear heels and strutting around.
Well, I didn't compete, but I did model a lot. I sort of used it to pay for school.
Just modeling. Yeah. Okay.
Yes. Yeah,
so
and actually in episode
no clear
3,
heels.
No clear heels, but I just wore those for fun.
Okay, all right.
To go out. But how do you know about the clear heels? That's such a fitness thing.
Oh
That's
my
so
God,
funny.
I'm obsessed with clear heels, and I always think they do their tans too dark. So
it is a really dark tan.
Yeah. But okay, so you were doing like just print fitness.
Yeah.
Okay.
And actually like episode 3, which just aired last Monday, is probably my favorite episode because my husband gets to be on it a lot, and we talk about how we met, and also like he does a Botox, and it's kind of funny and flirty, and it's like
you
so
give him
us.
Botox, you mean?
Yes, and it's funny because we've been married for over 10 years, but we still keep it hot and fun and
cute.
flirty, and so I just love sharing that part of my life with everyone, and so it is really one of my favorite episodes, and he's like fantastic and funny.
Well, let's get into some plastic surgery type of questions. So what do you do when your patient comes in and they want more? And you're like, maybe they came from another doctor that's now like enough girl, or they're like, I want the lips bigger, or what if I did more cheek, or whatever. Yeah, How do you tell them to slow it down, or do you not tell them?
This actually happens a lot. I feel like my responsibility as a plastic surgeon is always, it's always to do the right thing. I think that, doing the right thing is always really important. And I feel like part of my job is also, to educate patients about safety and have them think about the long-term consequences of what they're doing. Also, just because, surgery and all procedures, there is always a possibility of certain risks or side effects. And so with any person who comes in, we always have to weigh, what you're going to get or the positives with the potential risks. So yes, it does happen all the time. And it's not just wanting more or, maybe patients wanting something that's unsafe. I think when it comes to plastic surgery, it's also about like, are they emotionally and mentally in a really good place where they're going to have a really positive outcome from having work done?
Yeah.
Because it's the inside that really, is what people are trying to sort of change in a positive way with their physical transformations. And if I feel like plastic surgery is not going to make them happier or do something that's positive in their life, then I just won't operate on them. It's just not the right thing to do.
And so do you do everything?
I do everything.
So boobs, butt,
face, but mostly labiaplasty. So I do mostly body work. So I do a lot of mommy makeovers, a lot of body contouring. And one of my specialties is vaginal cosmetic surgery. But I am actually also trained in, one of the residencies I did was in head and neck cancer and reconstructive surgery. So I have a lot of experience in facial plastic surgery as well. But on the show, we kind of, everyone
have a little bit of a specialty.
Yes. And
so
mix it up.
Speaking of the vaginal label, so that's like when you have like an outie, right?
Like when there's excess labia minora, yes.
So you do that where you just kind of tuck it in and make it look cuter.
I mean, yes, but there's like this art to it. And I've developed a really special technique that just creates these really beautiful tucked in symmetric shapes. And you can't even see the scar.
And like, when does someone realize that they are self-conscious about their vagina being a different look?
Well, it's not just the look, but a lot of times it's a combination of comfort and the look because I mean, look, right now most people wear leggings or shapewear and things like that. I mean, like tighter clothing is something that a lot of people are wearing, and then they feel like, okay, they have to tuck it in. A lot of women do a lot of sports and are super active, especially like spin class, and they just feel this constant rubbing or irritation, or sometimes they have discomfort during intercourse because things are just pulling. Sometimes it's a hygiene issue. Sometimes like one side is a lot longer than the other. So the age is really broad. I mean, I have patients as young as 17, 18 years old. They're about to go to college, and they just feel like this constant,
so self-conscious.
It's comfort too.
Right.
Up to women in their later, I think the oldest labiaplasty patient I did was in her 60s, and she just said, I didn't even know this was a thing. It's been bothering me my whole life. And I mean, this is kind of graphic, but sometimes toilet paper gets stuck, or a hair. Like sometimes people have these extra folds and it makes almost like a little wing, and then a hair will get stuck around it and tie it off. So, it's a combination of something for comfort, but then also, if I'm down there, I want to make it look really, really good, So it's also aesthetics. And I mean, I think I always say the vagina is a really important part of our body.
Now, have you ever worked on people who are transitioning?
I personally don't specialize in that. It is a very highly specialized field, and there are plastic surgeons who do additional training in that area.
Cool. So now, someone also asked, is it ever too old to get a boob job?
So age really matters less when it comes to any elective surgery. It's more about the overall health of the person. So, you know what I mean? So it's not just an age thing.
It's going under if you're not.
So all of my patients do, medical clearance. If they're a certain age, they do EKG, chest x-ray, stress tests. You know what I mean? So, I mean, because when it comes down to it, it's an elective cosmetic surgery. So there is just no compromising when it comes to health. And there's just, for me, I just don't take any risks at all when it comes to patients' health. So, yeah, I mean, if you think about it, also, there's older patients who get facelifts and things like that, right? And that's a long surgery. That's 6 to 8 hours. So
I know you know how to do everything, but let's just talk about facelifts for a minute. Because
Sure.
I've heard a lot about this thread lift, and then other people say don't do the thread lift. I've heard mixed. What is your feeling of that?
I mean, so with any
so
new
explain
trend,
what it is for people.
So thread lifts are basically where there's dissolvable sutures that are placed underneath the skin, and it does an elevation of the soft tissues.
And it's basically just like a lower facelift, right? It's just
because you
picking this
can't,
up.
you don't really elevate this. So in a traditional facelift, what happens is the skin is elevated off the structures, like the muscle and the tissues of the face, and then those deeper structures are pulled back, and then the skin is just gently redraped over it and removed. So back in the day, they used to just overly pull the skin, and it made people look like they're in a wind tunnel.
Yes.
No one really does that anymore. So the thread lift is for people who maybe aren't ready to take that big step to do that big surgery, because it is a huge surgery, and they just want to get a little bit of a lift. I think the reason why there's so much controversy about it is that It's not considered to be a permanent treatment. And I think anytime you do any sort of procedure or, go into a space, it does make a little bit of scar tissue for in the future. But I think that the most important thing is for any, doctor who's performing it just to explain, to say, hey, this is temporary. This may create scar in the future. It's not going to be as dramatic as a full facelift. And I think the other thing is just that you have to be super careful about the facial nerve because the facial nerve comes like around the jawline with, like Alt's branches. So if you're not careful and you don't really know the anatomy, you might injure the facial nerve versus when you do facelift, you kind of see everything. So,
and have you ever had to fix some other surgeon's mistakes? Like a botch situation?
Yeah, so about 20+% of my practice is repairing botched plastic surgery.
Okay.
For me, what I see the most of is botched liposuction. That's like a huge one. And also,
and what does botched lipo look like?
So I think that what I've seen the most of is one where the liposuction is not done evenly in a way that looks natural. So you literally see like all the cannula marks. That's why in my surgeries, I've developed a special technique. It's like a multi-phase liposuction technique where I first break the fat into tiny little particles, and then I use a really tiny cannula that's just a few millimeters. And I'm like really OCD about this thing, so I literally count the exact number of strokes I put through each hole in each section. Like I make this whole map and I measure it precisely. And I rotate people in all different directions, so I shape them. Like if I'm doing the side, then I roll them on the side and do the side. A lot of times it's just done like you just lie down and you kind of like go from just like two little angles.
And you're just like sucking it up.
Yeah, so
right?
I tell people it's like instead, and I also use a small cannula. So it's the difference of like, let's say we're painting this wall, using like a giant paintbrush going back and forth versus like a watercolor brush with lots of little strokes in order to get it really even. So I think the cannula marks or just over suctioning, like being too aggressive, because if you suck too much out, then the skin gets like glued down to the skin. So I don't know if you remember, like, I remember the big thing in like the 90s was like Tara Reid. She had this lipo where it was like glued. Like everyone remembers that. And it's so noticeable. And I have like young women come into my office where they've been over suctioned. It's like lumpy. The skin is stuck down, but they have no fat. And sometimes I just tell them like, there's nothing surgical that can be done. Anyone who's telling you that they can fix it is just they're just not being honest because I probably do more revision liposuction, than anyone.
So, like, who is a candidate for liposuction and who do you think is not?
Well, the thing to know with liposuction is, number one, it removes the total number of fat cells in a given area. But two, you always have to leave a little cushion of fat underneath the skin. There's like a deep layer of fat and a superficial layer of fat. You can only safely suction the deep layer. So for anyone who pinches themselves and you feel less than that, then you're probably not going to be a great candidate for liposuction because there's just not enough fat. And also, I think the ideal candidate is someone who is already in really good shape because it's not for weight loss, you know what I mean? It's for shaping. And they just have stubborn pockets of fat that they want to reshape. So I usually will do liposuction with fat grafting to like the hips and the butt to be able to create that really beautiful like waist to hip ratio where it kind of looks really hourglass. Because the other mistake that I also see a lot in liposuction is the areas that are suctioned, they don't blend naturally into each other.
It's like a shelf.
Yeah, people will just literally like do a section like the hips and flank, and it looks like someone took an ice cream scoop and just like scooped them out. It's like, and then you have a shelf on top and a shelf on bottom. So for a lipo, I believe it should always like be thinnest in the waist, and then it just has to be done in a really artistic, like almost like a sculpture where you're sculpting the fat so it all blends smoothly.
And do you take the fat and then shove it back in the ass?
Well, yes, but I do it in a really meticulous and
but
gentle
you do
way.
that too, though.
A lot, yeah. But mostly like to round out, like you really have to shape it. It's like people think you can just like, like suck a whole bunch out and just shove a whole bunch in, but it really is almost like very detailed sculpturing if you do it in a way that you're supposed to, where it blends, it's natural without complications. Because if you just like shove a big glob of fat in, the fat in the middle dies. You know what I mean?
Yeah,
and then people get like lumps all in their butt.
There would be like, I heard, and I don't know if this is, but people would get lipo and then they'd continue to like eat poorly or gain weight, and then the fat wouldn't go back to that spot. but it would like find its way on your back
so you know
or
where
something.
people that how people think like if you do lipo it moves. It's because the technique of the liposuction, it wasn't done in a way where it blends. So what happens is, let's say we just suck out a chunk here from your waist, but you didn't blend it. Then when you gain weight, you gain it preferentially in that part right next to it that didn't have the lipo. So it looks like it moved. You know what I mean? So I think that liposuction is one of the surgeries that, like, it's done a lot by a lot of different people, because, you know, you don't have to be a plastic surgeon to be able to do cosmetic surgery, especially under local. Like, I've had patients who, like an ER doctor, OB-GYN, it can be, even in some states, I think, you don't even have to be a surgeon. You could have zero training in plastic surgery and do liposuction. So I think, you know, my take home is just, you know, it's important for people to do their research, make sure they go to, you know, a board certified plastic surgeon, but also just look super closely at the photos. Look super closely at the before and after photos. If you see like marks, lines, because if you scratch the undersurface of the skin, you know how if you like scrape your skin, it becomes dark? That happens on the inside, and literally you can see where, because I can see it on people's photos, you know, and I'm like, whoa, they're showing this, like they think it looks good, like I can see all like the crisscrossing, you know what I mean?
And do you, what about, is it possible to do liposuction like around your bra and arm area?
Yeah, it's a really common area to do it.
Because I feel like that's like an impossible area to like tone after you get to a certain age.
It's hard, and also like I noticed that I also gained weight there post-pregnancy. I don't know if it's like a hormone thing or maybe, well, post-pregnancy I was in my 40s. But yes, it's perfect for someone who's in otherwise good shape, and then you just have these, like, you know, it's just genetically, sometimes there's just pockets of fat that have a greater number than others. So liposuction is really ideal. It's kind of like, imagine you're made out of clay.
I think that,
so you're like taking it from one place.
I think the genetic thing is really kind of smart, because it's like, as I get older, I'm happy with like my size. I've always been lucky to not have to like diet or whatever, but you get to a certain age and you do gain some weight even though you're working out. But there's things like, well, I remember my mom, like what the back of my mom looked like. And she was not a workout person, but I understand that. I'm like, oh shit. Yeah, this is, you know, definitely hereditary. This is going to be a problem. It's not going to get better.
Well, I think you look fantastic, by the way.
Well, I'll show you the around my bra in a second. But like, no,
but yeah, so that's what,
true.
I mean, it's perfect. It's like, I always emphasize liposuction it does not replace diet or exercise.
Right.
And I always encourage patients, you know, to do healthy living. And in the cases that you describe where people go and, you know, they gain a whole bunch of weight after, I mean, I have these conversations ahead of time. I ask them, you know, like, where are you in your weight loss plan? Are you yo-yoing up and down? I mean, because I would encourage my patients to kind of get in a good place where they feel like they're sort of optimized themselves and done everything they can. And then the surgery just kind of cleans up everything. That's ideal. You know, and sometimes what happens is, you know, just doing a physical transformation, whether it's a tummy tuck or liposuction, it does help kickstart most patients to kind of be motivated. I mean, most of my patients after surgery, they end up being a lot healthier. They start working out more, they start taking better care of themselves, and they're just like overall kinder to themselves, because I really try to emphasize how important that is. Like that energy going into a surgery and, you know, how we care for ourselves, I think is, you know, like I treat every person like as a whole, holistically. It's not just about, you know, doing physical changes to them. It's really more how, you know, plastic surgery is more about how someone views themselves and how they think about themselves.
So what do you think of cool sculpting and M sculpting?
You want to know?
I want to know.
I feel like a lot of these new technologies, especially ones that kind of melt fat, you just have to be super careful because it does create a lot of scar tissue internally. And I only know that from personal experience because I do a lot of liposuction after some of these, not just cool sculpting, but a lot of these kind of like burny melting technologies. I mean, basically it takes sort of like fat cells and it injures them and then it kind of shrinks them, but it does make scars. So what I tell patients is this: if there is a lot of fat that needs to be removed or shaping, it's better to do the liposuction surgery first or fat grafting to get the shape in place. in that surgery, you always have to leave a little pinch of fat
Right.
behind. And then if you want to go use a technology to kind of get that last little bit or do some tightening and melting, fine. I think the problem comes from maybe like over-promising results with some of these things, and patients go in with this expectation they're going to like lose a ton of fat or have a totally different shape. And then when that doesn't happen, because most of these do like 10, 15%, then what happens is they feel like, oh my gosh, I spent all this money and I didn't see anything. Then they go get surgery, and then the surgery's like so much harder because it's already like so scarred, and it literally feels
Oh,
like
wow.
cement. Like I've have it on a lot of my surgery videos where you can see it's like squishy, it's like soft, and then you just like hit this wall of scar.
Oh.
So that's the any fatty, like fat burning technology. For M sculpt, I'm not sure. So for me, I'm the kind of person that if there's something that's like new that comes out, first I'll let everyone else experiment on it for
Yeah.
like a few years, and then I'll try it on myself first before I'll do it on a patient. So I just, anything that's like new or trendy, I always just try to really take my time and see long-term results. I mean, if you think about like even remember those gummy bear implants, like those got recalled.
You
So
mean breast implants?
the breast implant. So like for me, I'm after that
What do
happened,
you do, saline or silicone?
I do both. I mean, I've done both,
Mm-hmm.
but that particular implant, which was like that textured, firm, like that gummy bear implant that like everyone was talking about a few years ago, that ended up getting recalled by the FDA because it was associated with like a rare lymphoma. So I think from when that happened, it like shocked me. You know what I mean?
Yeah.
And then I was thinking, oh my God, like how can you recall something? It's like in people's bodies. I mean, thank goodness I'm like super conservative, right? And I don't just jump on the next like new and greatest thing. So thank goodness I never put a single one of those implants in a person because I don't know what I mean, I would be beside myself thinking that I put something in, a person who trusted me, and then it ended up putting them at higher risk for getting like
Right.
something like a lymphoma. So I always let everyone test it out. I mean, and then I'll like experiment. Literally, I'll experiment on myself a few times before I'll actually do it.
So, okay, let's go. Okay, so they were asking about your skincare. Your skin looks flawless, which it
thank
does.
you.
And you have a skincare company too, right?
I do. So my skincare company is called MD Glam.
Uh-huh.
And it's really, I mean, skincare is one of the things that I've been really passionate about for my whole life. When I was at UCLA, I did a lot of research on skincare because I'm like a nerd and I'm, a molecular and cellular biologist. So for me, I don't care what the bottle says, like what it's going to do. Like I want to know what's inside it. I want to know the ingredients and molecular compounds. So I think a few years ago, what happened was, people would always ask me for recommendations for skincare. And then for myself, I'm always like searching for something that had all the ingredients that I was looking for, and I just couldn't find anything that I could stand behind 100%. So I launched, I basically developed and formulated my skincare company based on scientific data and research, and created, because there's so many details. Like the science behind skincare is like a whole other field because it's like even vitamin C, it's like, what is the molecular compound? Does it actually, increase collagen? For one of my ingredients in my night moisturizer, there's an ingredient, hyaluronic acid, which a lot of companies, they put on the bottle, hyaluronic acid. But I was asking my manufacturer, what is the size of the particle in kilodaltons? Because there's only a certain size that will actually go into the skin. Otherwise, it just sits on the surface. And they were like, no one's ever asked us this before. It's just like, the hyaluronic acid everyone uses. I'm like, but it matters. Otherwise, it's on the outside and then it's drawing water out. And they're like, okay, fine. Well, I mean, that one raw material took like months to get. Like they from everywhere, you know what I mean? So there's all these details when it comes to skincare because I feel like if someone is going to spend their time and money on skincare, they want it to be effective, right? Like I used to have like all these bottles in my, and like you just don't like it and you never use it. You're like, is this working? Was it worth this money? And then you just like waste a whole bunch of money because there's like so many products. And for me, I wanted to create something that wasn't only effective, but also like I wanted to smell good and feel good and have that experience. Because like I used to put creams on at night, and then my husband's like, "Whoa, you smell like my grandma," and I'm like, "Ugh," and so I like go wash it off. I don't want to smell like grandma. Like that's so unsexy, you know. So I think that like the fragrance was really important to me, and then I hate that sticky feeling. Like when you put products on, it's like so sticky. So just the like for it to be fast absorbing, to feel and smell great was really important to me. And I'm so like proud, and I love my skincare line because I feel like it allows women to give themselves like that guilt-free self-care every single day. Like for me, like I have all this makeup on because I've been doing interviews all day, but I literally look forward to going home, that moment, and I can just take it off, and it smells fresh, and it just feels like so good. And what I love about the MD Glam products is not only are they really effective, anti-aging and cleansing, but they all are so hydrating because I have really super sensitive skin. So like everything is really hydrating. So your skin never feels raw or itchy or sensitive. Anyways, that's my long, passionate speech about my skincare line.
So besides using your skincare, what of all these crazy like lasers and peels and things do you recommend? Or I mean, because personally now I've never gotten one of those what I call the burn victim facials.
Yeah, and I don't think those things are necessary anymore.
Okay.
You can do so first of all, Botox.
Well, I do Botox.
Okay, so that's number one because it's kind of like a piece of paper. If we keep folding it over the years, it's going to make a like a crease. So I think for prevention, starting Botox at an age before you actually have those wrinkles.
So what age do you think?
It just depends because everyone's face is different.
Is there ever a problem starting it too young? Like I feel like
I started in my mid-20s,
right?
Which
because that's probably because you were in the business.
Yeah, and I think, like I said, it's preventative, and I actually have a very dynamic face. Like you can't tell because nothing's really moving right now. But I mean, you can sort of see where like the creases are, and it like gets stuck. And I just, I much rather do prevention now than need to have a forehead or face lift, soon. So I think Botox has been a game changer for most people when it comes to
I think it's like
prevention.
one of the greatest inventions.
And then the second thing is, so all those things you talk about, so like all these, microdermabrasion, IPL, Fraxel, they call them different names, but basically those technologies all sort of do like a very superficial kind of burn or peel on the skin. And then as your body is repairing itself, it builds collagen. And that's how I consider that like, basic maintenance. Also just facials, even if you just don't do that extreme, like facials are also good for cleansing the pores and like some of those glycolics that are a little bit lower concentration. Also great for maintenance. But I think the days of that like peel where people are oozing for weeks, that's less.
I kind of thought that in some ways for certain people that was a mistake. Like I have a couple friends that did it in their 30s, and I feel like they look a lot older now in their 40s.
Because those are very deep. I mean,
I almost feel like they took off that protective layer that may have protected you from getting a sunburn.
Right.
Now it's like unless you're going to never go back in the sun, it's like it gets rid of so many layers that it almost a protective layer.
You're so right, and you're really smart for saying that. Like those ones where you're like oozing for days are definitely much more aggressive, the ablative kinds. And I think that it's not. I mean, I think nowadays with people doing great skincare, great sun protection, and just like general maintenance, it's not really necessary to go so extreme. I think that those cases are people who've like maybe let a long period of time go, so everything's like super deep already etched in, and that's the only option. So I just think like prevention and maintenance is the key to everything. And you look fantastic.
What do you feel?
Super glowy.
Thank you. I mean, what do you think? I get facials from my girl in Calabasas, Susanna Melendez. Shout out. But what about the filler? Like, one thing I think that's kind of sad is when someone gets, so much filler like around the cheeks and under the eyes that it changes the shape of their eyes.
Yeah,
I always
could
feel
not
like
agree
the
with you
eyes
more.
are like the one thing that,
Yeah,
everyone has beautiful eyes in my opinion. And then when they change so much, like they go from an almond shape to almost like, a more Asian shape or
Right.
something, where it's like, up like this, and you're like, oh my God.
I mean, I think you have to be super careful with fillers not to overdo it because I feel like if it looks like you've had work done, all of a sudden it makes you look older. You know what I
Yeah.
mean? So I think that, and I'm sure we both we watch stuff on TV and you're just like, I see a giant chunk of filler in your
Or I
cheek.
see it like sometimes from the side, you see it.
Yes.
Like when a camera's coming from behind and you see someone, all of a sudden it's like a shelf for
Yes.
a cheek.
Yeah. You have such a detailed eye. See, you could have been a plastic. I see the same thing. No, exactly
Yeah.
what you're saying because, I just think that, I think fillers are really overdone, but I feel like now there's been a trend where people are trying to go for
Yeah.
a more natural look, even when it comes to lips. A lot of celebrities are starting to dissolve their filler or kind of let it fade away. I don't think that fillers should be used as if you need a lift, if you need a facelift, do a facelift. You know what I
Yeah.
mean? Don't just try to overstuff the face with filler and thinking it's going to pull it up. I think that's the times where
I'm
it
kind
starts
of for
looking
at a
weird.
certain age, let that filler dissolve, lose some weight, and then just get an old fucking fashioned facelift. Like at a certain point for certain,
I think certain procedures need to be done to treat a particular anatomic problem. You can't really, I think sometimes the non-invasives are overused to try to fix an anatomic problem,
Right.
and that's where it starts looking a little bit unbalanced. But
Yeah.
you have a really good eye.
Yeah.
I'm impressed.
Thank you. Well, I like this topic. Let's see. What's the fox
It's the
eyes?
thread. It's the same thing. It's like a
Oh,
thread.
explain
but
the fox eye.
Yeah, so it's again one of the threads, but it's used to literally pull the whole lateral eyebrow and
Is that
eye
like
back.
what Bella Hadid got? I know you can't speak on her,
I
but
think
it
that
looks...
that the pictures that I have seen associated with that, because there's some aesthetic centers that really highlight that.
Yeah.
I think that they've used that that particular picture as
Mm-hmm.
an example. But it's the same thing with any threading that we talked about earlier. You just have to be super careful because the facial nerve that raises, that goes to the forehead, it does run right there. And even doing surgery in that area is really tricky.
Yeah, because when you see someone who's young like that and they go back to their old photos, I mean, we all know when someone's gotten a nose job.
Mm-hmm.
And then you're like, oh, wow, they just look really good. And then you're like, you look at where the eyebrows were when they were 16 and where the eyebrows are here now. And you're like, okay, that can't just be Botox. So that is the threading of the fox eye.
It's a really particular look where the eyebrow literally goes straight back and the
Oh.
eye goes back. So it looks kind of like a fox. And I think,
Some people identify as a fox. Did you know that?
I think my brother identifies as a fox. His Instagram name is Fennec Fox. He's an animal lover and he loves Fennec Foxes. I just can't believe I said that, but it's so funny that you said that.
But okay, I had not known about that.
But I think with any procedure, you just want to think long term, right?
Yeah.
Something you think that might look cool or trendy now, just take your time, think about it. Are you going to like that 5-10 years from now?
I also think a scary thing with filler is that it's sort of I think there's a lot of procedures, and I'm going to do a really weird analogy.
That's
and
okay.
Most people may not. There was this book that was a movie that I read in high school called Flowers for Algernon. Have you ever heard of that?
I feel like I read that.
It was there was this guy and he wasn't smart, and they gave him this pill and it was making him really smart, and they knew that it was working because this little rat was able to get through the maze quicker.
Uh-huh.
And then all of a sudden the rat started to get dumber than he was before, the little mouse. And then the guy started. So I feel like there's a lot of procedures that the first time you get it, it's amazing.
Mm-hmm.
And then it starts to wear off, and then you go back and you're like, okay, I think I'm due for a touch up now of cheek filler or lip filler or under eye filler. And then it fucking turns on you.
I mean,
and you're like, oh, I'll never get back to that first time when it looked so amazing.
I think it's just that, a lot of procedures do make permanent changes in the tissue. So I think that as responsible plastic surgeons, we always have to make sure that we maintain the integrity as much as possible. So if you take something and you overstretch it, whether it's an implant or a lip filler or something in the face, then it's literally you take something, you pulled it really far. Obviously, when it deflates or it gets removed, those tissues are permanently changed. So I think it's just important for people to think, like I said, you just have to think long term and make sure that, whatever it is you're doing, it's something that you're going to, be okay with 5-10 years down the road. But then also just safety. You know what I mean?
What do you think about the ass trend? I mean, they are just huge.
Yeah, but it's there was a period of time where it was getting like really, it was too much. You know what I mean? And I would have patients come into and I think it has to do with social media too.
Of course, because everybody takes that big, I've talked about it, like they literally, every shot is from behind. They pitch out their cheeks. They do it an angle. Their ass looks just huge.
Yeah. And you just have to be careful because, and this is one of the things that I talked about in episode 3. Brazilian butt lift does have one of the highest mortalities of any plastic surgery procedure.
And what is it?
It's liposuction with fat transfer into the butt.
Okay.
Yeah.
So what about when people, because I've also seen like influencers on their stomach and there's like a pile of needles. So some people will just do filler in their ass.
So there's also people that will use Sculptra, which kind of just builds collagen, but it's not as effective as transferring, actual living tissue fat into the butt.
Yeah.
And then also like cost effective wise, because if you think about it, like even like maybe the smallest, Brazilian butt lift I would do would be like, 200 cc's or so. You have to have it has to be a certain amount of volume.
Right.
But if you translate that into how many syringes of filler you're paying for, that's like 400 syringes.
Yeah.
So it's like, I always say it's better to use your own tissues, your own fat, rather than just, go to a potential filler because, the results are just a lot more consistent when it's done safely and with really good technique. But yeah, I think the oversized butt trend, I used to see a lot of, patients would come time, like would bring pictures into the office. I could tell that the pictures were highly photoshopped. And, I just say, you know what? This is not realistic. Like, this isn't even real. And I was there was a period of time where I was like scared because I felt like this almost became the norm.
Yeah.
And to really overstuff the butt so much, it has a lot of potential complications.
Do you think flat asses will ever make a big comeback?
You know what? Anything is possible. But now I think there's a trend though, honestly. Like I've really seen people come in and say, you know what, don't give me this diaper look. Don't give me this
If you put your own fat in the ass, like obviously like the Sculptra, that'll eventually go down. So if you did your ass too big with the filler, then you can just wait it out. But with the fat in your ass, is anyone coming back around, saying, all right, I put too much fat in my ass, now take some out?
Yeah, so not any of my patients, because I really take a lot of time before I do the surgery to really understand not only the shape, because I think like
also,
no one wants that muffin shape.
No, and also
I think the heart shape. Yeah,
yes,
you have
and
to
how
shape
it goes, how there's no melding of the butt into the thigh.
Yeah, I hate that.
That's the biggest
I'm telling you, you're good. No, that's like one of the things.
I just saw one at Costco the other day.
Yes, but what I'm saying, it just looks so just like liposuction.
Yeah.
I mean, the fat transfer has to be done in a way where just the curves naturally blend into each other. For longevity, because otherwise it literally looks like someone's wearing a diaper. I mean, and it's so noticeable to have like just this like stack on like a skinny leg.
Yes.
So it just has to be done in a way that blends, and everyone has their own preference, like how much volume they want. But in the end, it's like creating these really, beautiful curves, I think, should be the goal. And for me, if someone comes in and they just want like, something that's outrageous, that one, I feel like won't be safe. 2, might have a lot of complications. Or 3, I think are just going to damage their tissues so much. Like, I don't feel like it's the right thing to do. Then I just won't operate on them. And I'm sure there's okay, there's hundreds of plastic surgeons down the street in Beverly Hills who maybe some of them will be willing to just overstuff you and take that risk. I just personally wouldn't feel comfortable doing that. I just don't think it's the right thing to do.
Yeah. And I definitely think the lip trend is on the downturn.
It already is. And lips are just like anything else. I've developed this really special feathering technique where I take the person's actual lip and then I do this like little crisscrossy. It's like all these little strokes.
Lips? Look at my lips.
I think your lips look great.
But what would you do?
But what I'm saying is
what would you do if I wanted a little
shape.
something?
So for the lips, if you wanted to make them just have that little pop, the way that I do it is I have these little crisscrosses that I put, so it takes your actual lip shape and makes it look fuller rather than like a little that strip of bubble gum. Yes,
look.
it's terrible.
Yeah.
And people like do it too close to the edge and then it bleeds into the outside. Like lips are really technical as well. I mean, most things in plastic surgery.
I think the whole fun of like anything like that is like once you have that done, like, oh my God, this is so much more fun to put on lip liner.
But one of the things that I notice a lot of people do lips, they just do like glob, 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 and they think, oh, you can massage it out. But that is not the case. I have had to repair so many lip fillers and kind of like dissolve a little bit of the glob, fill in between. It's like always so much harder to do it that way rather than just doing it like really detailed, meticulously, in a very precise way.
I once had one plastic surgeon say, oh, let me do your lips and let me give you a little butt crack in the middle of your lip, like right here. Mm-hmm. And I was like, no. I'm like, that is sort of like a genetic trait that I've never had my whole life. So I think by doing that, that's again really kind of changing your look.
Yeah, it does change the look. I mean, if someone, the two little pillows, I think that was also a trend. I mean, and there were a few patients that did request that kind of like to have like a little pillow on both sides. I mean, the good thing about most of the lip fillers is that they do dissolve. So as long as you don't overdo it or create any sort of anatomic damage, like when that trend is gone, you can at least go back and have your natural lip. But I think overstuffing the lips again or making that like weird bubble gum on top, I think sometimes if you're not careful, you can really change the anatomy. Then it's like permanent.
Okay, so let me see. Oh, someone said, why does it cost so much more to take out your implants and redo them than it would take it to do it the first time? Is that true?
It is just because, so if you're removing the implant completely, you also need to remove the shell around it, which is the capsule. So anytime you put a foreign body in your body, your body makes a shell around it, like scar tissue, in order to kind of like to protect yourself from the foreign body. So doing an implant removal where you have to carefully peel this shell of scar out from outside the implant obviously is much more complicated and much more detailed. And especially if it's someone who's had like a large implant, oftentimes you also have to do a lift because if you think about it, it's like stretched. Yeah. You take it out, then it, like the sag, you have to sort of tighten the skin now to like that empty pocket. So it's definitely a much more involved and meticulously, like a technically demanding surgery. And that's another reason why I always tell people, please think long term, about that.
But people that get breast implants, like if they got them a while ago, do they really? I mean, sometimes I'm like, do people really have to replace them every 10 years?
It is recommended because it is a device like anything else that's inside your body. So it's not like a forever, it's not a forever thing. And like, especially if you have a silicone implant, I have silicone, but a silicone implant, to have a leak, it's like really difficult to remove that.
But how would you know if you had a leak?
So the FDA recommends that you screen for a leak every few years. And the reason why they made the 10-year mark kind of like this.
You can't screen from a leak just from a regular mammogram. It's a different test?
You have to, I think the starter imaging is mammogram and ultrasound. And then if they can't tell diagnostically, the gold standard is an MRI. I think a lot of these things, this discussion is really important for patients to have and to know before getting implants. Because I always tell patients you're going to have multiple surgeries. It is a commitment. You have to screen for a leak. Even an intact silicone implant, you are still exposed to silicone. And then some people's bodies, they just don't like implants.
Yes,
so that's a post that I made today.
It seems like many people. There seems like there's always this. We see somebody on Housewives or whatever getting their boob job. It's like, okay, by the 5th time, maybe this isn't for you.
Yeah, I mean,
it's just like a heart transplant or something. Not every body's going to accept it, right?
And it's funny that you say that because I literally today just did a post on something called breast implant illness, which is where basically, the implants just make women super, super sick. I've personally had 3 friends who developed breast implant illness, and they, luckily they were treated and now they're doing great. But it's like, it's devastating. I mean, like no one, of course, like to go through a whole surgery again to remove implants, like that's a lot. Like, and I think that is just a lot of women who have had breast implant illness. They just go through so much that they end up, taking their implants out and the scar tissue around it. So, I mean, I think all surgeries have risks. All surgeries have potential side effects. And I think that especially for something like implants where you're taking a foreign body and like putting it in your body, it's really important. It's like the responsibility for us as doctors to really take the time and have patients understand, you know, long-term and all the potential risks. I know when I got my implants, they were just like, oh, what do you want? Here, you know, like, see you back next Monday. It was like a 5-second consult. You know what I mean? Like,
Yeah.
I was really young and I'm like, yeah, sure, of course. Like, I don't want to have to wear padded I mean, I was like in my early 20s. I just didn't have that like detailed discussion. And also like, even when and I've always tell patients, like, you have to think about it. And, if you have a lot of allergies or if you're sensitive to things or maybe if you have underlying autoimmune questions, I mean, there's just so much we don't know about any device out there. You know what I mean? It's just important to really think about all those things.
What celebrity do you think has had really great work?
Oh, I mean, those are the ones where you can't tell. I mean, I think that, there's, I'm trying to think of how to answer this because I actually have a lot of celebrity patients. So I'm like, I'm trying to think of a way to answer this question without violating any patient privacy. I mean, I think the best plastic surgery is one where you just can't tell that they had something done. I mean, I really feel like that's the key, where they just look beautiful, refreshed and timeless, but you're not just like staring at them like, oh my God, you just did blah, blah, blah. So, I mean, that's my personal aesthetic as a surgeon. Everyone has their idea of what, they find to be beautiful, right? It's like, in the end, it's very subjective. And I think it's important for patients really, when they're looking for a plastic surgeon, just to find that perfect fit, and vice versa. Like for me, if, it's a relationship, you know what I mean? It has to match the understanding. Also, the energy, I think, is really important. It's like probably one of the most intimate relationships you can have, patient and surgeon.
Yeah.
And I think that just matching that aesthetic and sort of like the philosophy behind, why someone wants to get work done is really important, and it's, and you'll see, like, so on Dr. 90210, the show it's like really groundbreaking in the way that like the patient stories like are really delved into, and it really showcases plastic surgery the way it really is, which is, meaningful. Like the patient stories are so transformative, and it really is life-changing. And I know that sort of historically, plastic surgery has been seen as like really superficial and a lot of vanity.
Mm-hmm.
I kind of focused on that. And I think, maybe 10, 15 years ago it was kind of like important to have it be entertaining in order just to even open up the conversation where it wasn't taboo.
Yeah.
And I think now we're in a place where we've evolved as a whole as a society to be able to, respect people's individual decisions, like what they do for their own body, but also really like understand why it is that someone wants to get something done. And that's like what I love so much about this show. The patients are like so amazing. Their stories are like truly inspiring, and also really relatable. So, I mean, I love, like, this show is just, I love it so much. I could talk about it forever.
Well, I'm so glad that you came and that you guys are doing this, and that I think it was brilliant to feature the female doctors, and I think that makes it fun. And tell everybody where they can follow you and find you, and are you taking new patients and all of that?
Yes. So my main Instagram page is Beauty by Dr. Kat. So I do film my surgeries live on my social media for the patients who want to. So if you want to watch those, go to my Instagram page, Beauty by Dr. Kat. The skincare company, the skincare page is My MD Glam. And for before and after photos, you can go to my website, beautybydrkat.com.
Awesome. Well, thank you.
You're welcome. It was so nice to meet you.
Off camera.
Of course.
Let me get out of this jumper. Hello and welcome to Juicy Scoop and my YouTube page. A lot of you are enjoying watching the interviews of Juicy Scoop and myself do these hot topics on YouTube, as well as all of my sketches are put on here. Premium content from my latest stand-up special is on here. So please subscribe to my page. Subscribe. Don't I point down? I don't point down, subscribe, share, leave a comment, tell people, and then you won't miss anything as it comes up. I appreciate it. Thank you.